Hello, this is Lance French. This is my return demonstration for the assignment of IV initiation of a peripheral intravenous infusion. So, firstly, we're going to check our 6 rights of patient medication administration, which are the correct documentation, the correct route, correct patient, correct time, correct medication, and the correct dose. So, firstly, I'm going to approach the patient, perform my ham hygiene, make sure the environment appears safe, that the bed is at a comfortable working height for me, that the guardrails are up to ensure the patient's safety, and that we're affording for privacy as well as body mechanics of myself and the patient. So I'm going to get 2 things before I begin. One is an order from the healthcare provider. The other is the medication administration record. And I'm going to start by reviewing the completeness of the provider order, its accuracy, and that it's for the appropriate patient, the correct amount of IV fluid, the correct type of IV fluid, any type of medications that ought to be added, the infusion time that it ought to be started, the duration of the infusion, and the time that may be specified to end the infusion, as well as the purpose of this infusion. So, considering the type of solution and the age of the patient, I'm going to attempt to select the appropriate infusion needle. And in this case, it is a 1-inch long 20 gauge infusion needle. So having that on hand, and that the order is written for 500 milliliters of 0.9% sodium chloride injection USP, and that the expiration is July of 2020, so that is not expired yet. So I have that is correct. I'm going to check this bag for particulates, any defects, its expiration date, which I already have, and any discoloration. So I'm going to approach the patient and identify the patient with 2 identifiers. In this return demonstration, my model patient is going to be this this sausage to simulate something having a penetrable skin, a surface that will approach as if it were a live patient, and it's actually a pretty good model for this demonstration. So now we have my identifying the patient with 2 identifiers, being his name and date of birth. So this is John Doe. He was born January 9th, 1945. I'm going to explain the procedure to this patient that his healthcare provider has indicated, written an order for an IV infusion of 0.9% sodium chloride, 500 milliliters. And so I'm going to put this patient in their bed in a comfortable working height. I'm gonna interview them regarding their experience with IVs, what their perception of IV therapy is, what their understanding of this purpose is, and if they have a preference for an IV site or which side of their body. So firstly, we're gonna start kind of beginning our record keeping. I'm gonna label this bag with the patient's name, their date of birth, today's date being 4/12 of 2020, the registered nurse administering this medication, the time that the infusion begins, the time leaving a space for when this infusion will be ended, and as well as the rate of infusion that is specified in the prescriber's order and the medication administration record. So now I'm going to get the appropriate administration set and remove that from its packaging. So I'm going to label this IV line with today's date and the time, and when this infusion is initiated, and my name. So I'm going to remove this cover on the spike, maintaining its sterility, and I'm going to pierce this solution. And I've locked my saline with its valve. Pierce that. And that looks fine. I'm going to get my linen barrier placed under the patient's extremity that they prefer. So I'm going to prime this administration set. I want to see this about half full of its infusion solution. And that's been achieved now. Now I'm going to prime this solution to evacuate it of air. Okay, and that went really well. So I've got the patient's arm here. I'm going to tourniquet this. I'm going to try this. So I'm going to apply this tourniquet 4 to 6 inches above the ideal IV site, and choosing an IV site that is not above a joint. So I'm going to try to palpate and observe for a good vein. So I'm going to ask the patient to open and close their arm, their extremity, and I'm going to massage from proximal to distal to try to get that vein to be observable. And if I need to, I will take a moist, warm towel. I can help that to get it to vasodilate and observe that. So I'm watching for that. I'm palpating. So I've found the site that I want to pierce with this IV set. It's hanging dependently, and it's at a very it's the most distal place in the extremity that I can find. So if there is excess hair present, with scissors I will clear that hair carefully, not shaving, so I can have a good clean approach to that place. So now I can remove this tourniquet, let the patient relax for a moment, okay, and kind of let the blood circulation do its purpose. Okay, so I'm easily visualizing my IV site. I'm going to clean from the central out, allowing that to air dry. Give that a moment. I'm going to don my clean gloves. So I see that that is dried well now. And remove this, maintaining its cleanliness and its sterility. Okay. Now with my non-dominant hand, I'm going to pull the skin taut distally on that extremity, and I'm going to pierce this at a 10 to 30 degree angle, watching for when I achieve flashback. Okay, I have achieved flashback now. Now I'm going to release the tourniquet, apply that down against the skin, retract the needle, and advance the catheter in so that the hub is quite close to the skin. Now I'm going to obtain a piece of gauze. I'm going to place this clean gauze between the hub and of the needle of the catheter and the skin. Okay, and I have pressure on that now. So now I can remove that, and I can go towards the sharps container. Contain this 5 milliliters of 0.9% sodium chloride for its saline rinse. To flush that. Okay, that's achieved now. It's going to go to its place. And now, while maintaining sterility, I'm going to expose this hub. Seeing that I'm still primed, there's no air visible. Seeing the lock, securing the lure lock. I'm going to achieve my chevron, attaching this carefully to the patient's skin. Okay, that's looking quite good. Now, I just need to get my shore sight. So, with having that not covering that joint, I can now date, initial, and write when this infusion began. So I'm checking lastly that the infusion rate is as specified in the order and the medication administration record. I'm going to write what I did in the medication administration record when this began. I'm going to be mindful of when to anticipate this infusion ending, either if it's volume dependent or time dependent as specified in the medication administration record and the order from the provider. And now I'm going to dispose of these supplies in their appropriate place, as well as lower the bed to the safest position and make sure the call switch is within reach of the patient. And that concludes my peripheral intravenous infusion for IV, initiating an IV for this class. Thank you.